And I'm just going to give everyone a minute to connect to their audio. Just another minute. It looks like just got 2 more people we're waiting to join. Okay. All right, I'm going to go ahead and get started while those last 2 folks connect. Hello, everyone, and welcome to today's virtual interactive panel discussion brought to you by the ACHE of Georgia chapter. My name is Sandra McGarry, and I will be serving as your ACHE technical host for today. Before we do get started, I would like to go over a few items to help you navigate the program in our virtual environment. For the purpose of noise control, your lines will be muted for the duration of the session. The chat function will be available to you throughout the entire event, and we absolutely encourage you to use that to help make this a more interactive event. The event is being recorded and will be available for viewing in ACHE's Learning Management System in approximately 2 business days. Today's session is worth 1.5 hours of ACHE virtual interactive education credit. And to earn this credit, you must be logged in for the entire 90 minutes of the event. All attendees who meet this requirement will have their 1.5 virtual interactive education credit applied within 2 weeks from today's event. We do encourage you to complete the evaluation. The link will be put in the chat box multiple times before we close out today. And to begin our session, let me just turn it over to the ACHE of Georgia President, John Paul Kroom. He is the President and Senior VP at Wellstar North Fulton Hospital.
Thank you, Sandra, and good afternoon, everyone. Thank you for being here. It's my honor to welcome you to today's ACHE of Georgia virtual interactive meeting. Thank you to ACHE for allowing us to use its learning management system so we can provide you with virtual interactive credits. Today, we have a very packed agenda, so we'll take a few minutes to do some important chapter announcements and then move on to our program. Our program is entitled Digital Health and the Healthcare Delivery System. I'd like to start our meeting by recognizing our sponsors and expressing gratitude to these corporate sponsors. First, our platinum sponsors, Atrium Health Navicent, Grady, Moss Adams, and Wellstar Health System. Our gold sponsors, Act Talent, Grant Thornton, Healthcare Program Advisors, Piedmont Healthcare, Northeast Georgia Health System, and Visia Technologies. And last, our silver sponsors, DT Spade, Georgia Nurses Association, KCA Firm, Metro Atlanta Ambulance Service, SSR Inc., and Vivleo Health. Our upcoming meetings are displayed here, but the highlights include ACHE Georgia Week, which is April 15th through 18th. Each day at 11 o'clock during this week, we will have a 30-minute free webinars featuring our committee chairs and how to get involved. On April 18th, we're offering a free webinar, Elevating Healthcare Leadership, HR Insights for Aspiring Clinician Executives. Our next in-person lunch will be at Maggiano's on May 16th. Please join us there for in-person credits. And visit the events page at acheofgeorgia.org for details and registration on all of these events and others as well. To encourage members to take the Board of Governors exam, our Fellow Advancement Committee is offering an online archive of last fall's prep class for $50. Look for details on our homepage. ACHE of Georgia offers several ways to stay connected through social media using Facebook, LinkedIn, and X, formerly known as Twitter. We'd also like you to get involved by serving on one of our ACHE of Georgia committees. Contact acheofgeorgia.org for more information. Today's program offers 1.5 hours of ACHE virtual interactive credit. Our topic today is digital health in the healthcare delivery system. And as you can see, we have an outstanding panel, and it is my pleasure to introduce our moderator. Eddie Lai is the Senior Manager of Life Sciences and Digital Health Ecosystem Expansion for the Metro Atlanta Chamber. He directs MAC's recruitment and growth strategies for the life science, which is pharmaceuticals, medical devices and instruments, animal agriculture, bioscience. Digital health, which includes health IT, mobile health, wearable devices, telehealth and telemedicine and personalized medicine, and age tech ecosystems. Prior to joining the chamber, Eddie was at Emory Healthcare as an operations and strategy administration fellow, working on hospital and system-wide initiatives, including COVID-19 supply chain procurement and outpatient COVID-19 vaccine clinic operation. He subsequently joined the Emory Healthcare Innovation Hub as its first administrator, engaging with companies external to Emory as well as with internal stakeholders to operationalize projects within the health system. He is also the co-founder of the Association of Asian Healthcare Leaders, AAHL. At this time, please join me in welcoming your moderator, Eddie Lai.
All right, everyone. Thank you so much, John Paul, for the introduction. And I'm glad to be on this panel and be joined as moderator by our lovely panelists who we'll get into soon. So as you guys know, signing up for this interactive panel, this will be a time where we can engage with each other as well as our panelists. And so there'll be a number of different questions that will pop up during this time that we go through. And so again, these questions will have to do with digital health and the healthcare ecosystem as our topic, but will inform some of the discussions that we might have as well as we go through this time. And so we do have those popping up soon before we go into intro. So if those questions can just come up for the group, everyone get ready to engage and for our time. All right, and as those questions pop up, they should be popping up soon. I'll let our panelists introduce themselves from left to right, starting with Ayana.
Eddie, do you want me to do the poll questions now, or do you want to introduce people first?
Yes, please, Bruce. Let's do the questions now.
Gotcha.
And with that, just to make things efficient with the time, as the poll questions pop up, we'll start with our first question with that combines the introductions with our panelists. So as you introduce yourselves, here's the question. It's, tell us a little bit about how you got into your role and why you think your background is relevant in engaging with the digital health ecosystem and technologies in your organization. We'll start with Ayana.
Sure. Thanks, Eddie, and great to be on the panel with everyone today. A little bit about myself. I've been with Siemens Smart Infrastructure for about 23 years, based out of the Atlanta area, and my role is to oversee our entire healthcare market for the U.S. Getting into this role, I've done a lot of work across our business. We create a lot of technologies on the infrastructure space from a facility perspective. But I spent a lot of time across the business working with our business owners, our salespeople, and then wanted to focus more on the market, actually work closer with the people that we serve, the people that receive our technologies. And that's where healthcare, out of all of the markets that we focus on, was the one that was kind of resonated the most for me. And so healthcare was something I actually wanted to go into coming out of college. I got an electrical engineering degree, but medical was the other option, and I so happened to end up still working in healthcare from a different perspective. But why this topic that we're talking about today with digital health is so relevant is because we are increasingly seeing across the country organizations, the needs that they have around digital health and advancing patient care is creeping a little bit into the facility space. Some of the technologies that we create have to integrate. There's a need for our environments to be a part of the healing environment and our technology to help with that. So that space is a little bit, we can talk about it further in some of the questions that we have, but more and more we're seeing that the infrastructure, the buildings that we support and outfit, they play a critical role in the health space. So that's how this topic kind of attracted me a little bit.
Excellent. Thanks for that, Ayana. Next, we have Scott.
Thanks, Eddie. Good afternoon, everyone. Scott Smiser, Chief Technology Officer with Emory Healthcare. I've been with healthcare and IT for 32 years, believe it or not. Started out of high school thinking that I was going to be a physician and had a knack for technology and did everything in hospital operations from pull and punch cables to swap devices. Ultimately, spent about 20 years of that career in healthcare, health systems, 10 years as a consultant, and joined Emory last year. So I've seen all the different gamut of service delivery technology, ran application stacks. So I feel like in my role here, I'm able to bring together that application clinical experience with the technology experience in my role at Emory. So thanks for having me and appreciate being invited to the panel today.
Excellent. And last but not least, we have Lori.
Hi, everyone. I'm Lori Westfall. I am a digital innovation manager with Catalyst by Wellstar. We are the innovation and venture capital arm of Wellstar with $100 million in our funds. I am a former epidemiologist. My PhD is in sociology. I have a master's in public health from Emory. So I worked both at the Florida Department of Health and the Centers for Disease Control and Prevention. So I'm very outcomes and evaluation oriented. And I would say about 10 years ago, I made the pivot into technology, where I worked as a user experience researcher for many years, really understanding how people interact with technology, what their needs are, what their friction points are, in order to build better solutions. So being a Catalyst is a real sweet spot for me of combining both my healthcare background and what I know about the user experience within technology as we look to source digital health platforms to be able to launch them within the Wellstar ecosystem. So thank you. I appreciate being here today.
Excellent. And just for our audience, as you can see, we really worked hard to see and get a wide variety of different speakers and panelists who can speak to this topic today. If you guys are seeing this pop-up that I'm seeing, you're seeing some of the poll results. And so this question, just noting, was on adoption, and it was to the group of how would you rate the current integration of digital health technologies within your healthcare delivery system? And encouragingly, we had a lot of moderately advanced responses, as well as neutral, but certainly some lacking. And noting also, there's a small group that's very advanced and a smaller group that's significantly lacking. And reading number 2, you got what do you believe is the biggest barrier to adopting digital health technologies in healthcare systems, with the biggest kind of vote getting is cost, next with resistance to change among staff, then data privacy concerns, and then around the same, actually tied, is both lack of technical training and regulatory changes. So thank you all for answering that as we go into this time. And so question for the group, in what settings and for which types of patients have you worked with or engaged with digital health services and products? We'll start with Scott.
Yeah, thanks, Eddie. I think in today's environment, you've got to meet the patients where they're at, and quite honestly, where they are is on a mobile device. So for our organization, we're really looking at, where are our patients outside of the care setting? What are we doing to engage them in a meaningful way, and really building that digital front door that brings all of the assets technologically and from an experience standpoint together into one app, one experience. But we're also looking at ways to engage patients as they get to our facilities or our clinics. And then more importantly, what we're doing when they're actually on campus in our facilities. So from my vantage point, I feel like, we're not isolated to just looking at one part of how to engage the patient, but looking at where they are at the moment before they get there, while they're getting here, and once they arrive. But then we're also looking at ways to engage our workforce in a meaningful way, from clinicians and physicians, and giving them access to tools and platforms that are really going to enable them to deliver a better patient experience.
That's great. Yeah, certainly it's as we see in healthcare, it's looking at these approaches that are additional to the core mission and vision and values of a lot of these organizations, which ultimately is to provide care, but certainly keeping in mind the world around us and the technologies and opportunities that exist. So thank you for that, Scott. And speaking on kind of engaging with some of these technologies and to ultimately drive patient experience, I believe Wellstar has this Catalyst by Wellstar program that has some of their focus in the digital innovation on that space. So Lori, I'd ask you to kind of speak next to this question.
And I will say, within Catalyst, we have 6 focus areas where we look to source startups. It's care of tomorrow, it's the future of work, the customer experience, data security, supply chain, and sustainability. And some of those may be sourced outside of healthcare, right? Looking for other solutions like, an energy audit platform where we can look across the healthcare system, look for gaps and remediate those with more sustainable sources. So we're creative in our approach. We are looking to solve for problems within the healthcare system. So we try to stay close to our clinicians and to our staff to be listening for those and find startups that help come up with creative solutions. We're looking to remote patient monitoring so we can have care everywhere, to include patients maybe in remote areas who might not see a physician or a nurse at any point, where we can connect with them through a platform, through a device. We're trying to think very creatively about and very thoughtfully about trying to meet those needs of patients and clinicians, improve the clinician workflow as well. And again, with the ultimate goal of improving patient outcomes.
Excellent. Really good perspective and really interesting approach on the different verticals as many people on the kind of healthcare delivery side are learning. Health is not just going to the hospital, but it's all the experiences and pieces surrounding that in our daily lives. Ayana, I would love to hear from you on the Siemens end. I know you guys have different divisions working on different areas in healthcare as a vendor and as with the things you guys do.
Yeah, and I think it's important, thank you for mentioning that, because Siemens, we have a couple of different spaces of healthcare that we focus in primarily. Obviously, the one that I just mentioned about smart infrastructure, so the buildings and facility space, but then we have our sister company, Siemens Healthineers, which many of you are probably familiar with their medical technology, MRI, CT scanners, and cancer treatment. So obviously, from that side, they hit every single aspect of patient experience from a treatment perspective. But then also what people don't realize is on the infrastructure side, patient satisfaction and patient experience for us, we do have an impact on that from a facility space. The smart patient rooms that some of your organizations may invest in, that plays a role in their experience and their satisfaction. But what I'm finding more is that it's not just their ability to turn on the lights or off the lights and the AC and these conveniences with the shades, but also it's their experience with the staff and making sure that the staff is able to operate efficiently and productively. They can find assets, being able to track assets. A lot of these things can contribute to a lot of frustrations with staff, and that can inadvertently impact a patient's experience. If that nursing staff or that OR staff is not really conscious of how their engagement is, it can impact it. So there are things in the facility space, from the environment controls to the assets that we control and track, and how we support the staff in their hospital operations that actually play a role. And so we directly touch patients from that perspective, a lot more on the Healthineer side, but very much so some on the infrastructure side, but also inadvertently through the staff productivity solutions that we provide.
Great. And given that this is a interactive session, do note that we're looking at some of the comments. Obviously, we can't address each of them as we want to make sure we get on time. But to your last point, Ayana, with this keyword of staff, I'll note that there was a comment in the chat about one of the barriers or challenges that some healthcare organizations might face is discrepancies between the 3 groups of operations and IT and executive leaders. And so, you know, just keeping that in mind for the group, to both watch out for the chat and keep these things in mind as we all think about these both opportunities and challenges. And so that, you know, speaking to the question part, let's get to our next interactive part with another question break. And so these questions should come up soon from our lovely ACHE of Georgia team. And the question theme of this is actually digital health technologies. So that should pop up on your screen pretty soon. Okay, and as we kind of await those questions to pop up, you know, for the sake of time, we'll keep moving forward a little bit with our next set of questions. So this next set of questions, going off some of this area, is a little bit more technical to start, but certainly wanting to hear different perspectives. And you're going to see these questions pop up now, actually. So I'll give just a little bit of time for you guys to read through and answer as well. And I'll say this, as someone who covers this industry with my job at the chamber, it's really cool to see all the excitement from digital from healthcare leaders on digital health and different aspects of the opportunities that exist within this space. And so this is really exciting to see, and we'll see the answers once everyone gets those in. But going off of that, what are, this is a question we'll start with Scott, but obviously open to some of the other groups. What are the technical requirements at both ends of the operational considerations for developing digital health services?
Good question, Eddie. So, you know, at Emory in particular, I've been with the organization a little over a year. So one of the first things that we did was a capability model that we basically went through and looked at the assets of the organization and put our capability into 14 different quadrants. And so I've stood up an enterprise architecture team that basically looks at those quadrants where there's duplication, we need to rationalize out those functions, but where there's not and there's blind spots, how do we fill those voids? But I think more importantly, you know, all of these initiatives are very technical in nature. A lot of times you're trying to integrate systems that don't talk well together or have never talked together at all. So really looking at the intake process of those ideas as they're curated, of how could we physically have that go on. But I think the other part is the operational considerations to that question. I mean, some of these services and ideas can be very disruptive, yet valuable to the operation. So how do you get those stakeholders and those leaders and that staff and the patients engaged in that?
अरे बाबू
And so
ये प्रिंस बनाया था वो लेके आओगे क्या प्रिंस
So I think everyone was just muted. So I know, Scott, you were speaking.
No,
we're all back. Yep.
So the operational considerations, just talking in the vein of, you know, they can be disruptive, they can require a lot of coordination. So what we've done of late here at Emory is standing up experience councils. So we've got various different experience councils in those pillars of expertise that we're really curating ideas with those experience councils to say, what are the priorities of the business? You know where we want to go strategically from a vision standpoint. So those experience councils are really married into that architecture design capability model, so that as ideas are curated out of those experience councils, we could say, you know what, we've got something for you. We already have a system that does that function. So that's how we're trying to address it. But it does take technical requirements marrying with the operational considerations. You can't have one without the other. And what I tell folks here at Emory is, I don't want to do technology for technology's sake, because it's just a waste of time and money, in my opinion. I want to do things that are bringing value to patient care, releasing burden from the workforce, or really transforming the way we can deliver care at Emory. So
That's excellent, Scott. And before we kind of go into the results of the interactive survey and the poll results, I do want to note that exactly what you said was a comment that we didn't talk about at the end of last time, but someone did make in the comments, was talking about the integration concept of you know, disparate clinical systems and operational systems and technology that these hospital systems engage with. I know that, and Scott, you know this too. When I was at Emory Healthcare Innovation Hub, Emory was doing that large you know, a big transition. And so with that comes not only all the pieces of the operating that on a technical level, but the change management. And so, wow, the chat is now blowing up, everyone. So again, want to be mindful that can't read all these, but thank you all for the input on this interactive session. And I'll note that there is going to be a Q&A session at the end for everyone to, as best they can, try to get their questions in, but just be mindful that we can't necessarily go through everything. And so just reading off some of the results actually of the first question, it looks like there's a pretty close tie in regards to the digital health technologies question on which technologies do people think is going to really impact the patient outcomes, which are both remote patient monitoring and artificial intelligence, or AI, as we all like to say, in diagnostics. And noting that there was a comment that said, sometimes telemedicine and remote patient monitoring can be considered the same as well as wearables, right? And so there's a lot of overlap in these technologies, as we know, and we'll keep that in mind as we go forward. So really cool insights on there. And again, that order was AI. The order was RPM, remote patient monitoring, AI and diagnostics, telemedicine shortly after, and wearable health devices. Notably, no votes at all for blockchain or healthcare data security. And next, the other question was, have you or your organization implemented any form of AI in clinical decision support or patient care? And really cool to see, almost 50%, half the respondents said yes, but only in limited aspects. Then another third saying not yet, but planning to. Smaller amount saying no and no plans to do so, interestingly enough. And then 5% saying yes extensively. So really interesting to see the gambit, and that's why we're here today to discuss these topics. And so in that perspective, we all know, and we're all seeing this in terms of both the digital health innovation topics, that there are opportunities to engage. And so what kind of partnerships could hospitals and health systems consider to maximize their digital health endeavors? We'll start with Lori.
Well, I know one big partnership we have at Catalyst is we are one of 12 members with Engage, which is basically a venture fund where these 12 companies have committed time and money to sourcing startups that could be relevant to one or more of our areas. I think that's a really key partnership for us at Catalyst for sourcing startups. Jessica, the person who is supposed to be speaking today, is our partnership person, could probably speak a little bit better to that, but I would say partnerships are key for sourcing and for lessons learned. There are things that are happening with Delta that could pertain to us, as well as, customer service, Chick-fil-A, which is also a member of the Engage cohort. Those kinds of lessons and sourcing startups that you might not typically associate with healthcare, but could help solve healthcare problems, are really kind of key for us in being very creative and innovative in our approach.
Yeah, that's really interesting, and a really cool opportunity for you guys to be and engage as catalysts. And since we are in Atlanta, in Georgia, and talking about Georgia and digital health and healthcare, I'll note that it's you talked about Delta. I know that they are one of the first groups, airlines, to have this Delta Health thing, which is really fascinating. Ayana, are you able to speak any bit to partnerships with the hospitals and organizations?
Sure, absolutely. A little bit from both sides. I'm kind of representing Siemens across the board here today, but Siemens, from an infrastructure perspective, we manufacture technology, infrastructure technology. Our sister company manufactures medical technology. Kind of gave an example of that earlier, the MRI, CT scanners. In both cases, the type of partnerships that come to mind and the ones that we promote, and we are seeing a lot of success for our healthcare organizations, is partnerships where the healthcare organization itself is partnering with the technology providers. You find ways, it may be existing ones that you're working with, and those are probably the best ones. If you're doing a little bit of business with any of these providers, they're always creating new technologies, advanced technologies. And I think sometimes organizations may be reluctant to engage with them in that space, but I would really encourage you to reach out and say, are there any councils? Are there any, portfolio feedback groups that I can get involved in? Are there, because when you start creating partnerships, the world opens up. There are a lot of opportunities that these technology providers will offer that they normally would not provide in a vendor customer relationship. So think about, asking for co-creation sessions. You have a need on the hospital operations side, or it even may be the facility operations side, and you want to kind of have an experience for your facility people or for your patients and visitors and staff. It doesn't exist. The systems that you have are disconnected, but consider approaching some of your providers with a partnership that says, hey, let's look at how we could create this unique use case for us. It could be a visioning workshop that just talks about how it could be done. You don't worry about the product, you don't worry about the technology, you just talk about, and I think that's kind of what Scott was saying a little earlier too, is thinking about what you want it to be and maybe do some pilot engagements. And that's a very easy thing that can be promoted in partnerships. And it's a great way to ensure that before you invest heavily in a technology, you're addressing those challenges, the unique use cases that you have ahead of time. And it's a safe way, if you think about it, to scale up to those new technologies. So it doesn't always have to be just a vendor, let me buy a little bit, put it in a partnership perspective, ask to engage with their IT people, have your IT people talk with their IT people, get your designers in touch with some of your customers, your hospital experience teams. And then honestly, that's where a lot of the innovation can come. Partnerships like that, they really provide the flexibility to start small, grow as need be. And then, more and more, we're focusing on that at Siemens. We have our health engineers who has value partnerships where they are literally engaging in new technologies, things that have never been thought of before, but it is a growing need in that healthcare system. So, and what we're trying to do is convert our vendor, quote unquote, relationships into partnerships, because at the end of the day, the healthcare organizations get a lot more out of it, and we're seen as a trusted partner as opposed to just a vendor. But I do think that is any type of partnership that allows you to explore things that haven't been done yet before it even comes out is really going to be a benefit to healthcare organizations.
Yeah, thanks, Anna. That's a great perspective on this kind of concept of co-creation and collaboration. And it's actually you guys must be cheating. You're looking at the chat. I think like there's a lot of comments on how important it is, and Scott spoke to this earlier on engaging with some of the folks who are doing the work in the space, whether that's providers and other users, and maybe whether that's working with your patient family advisor, things like that in this group. I'll share that, to your point, Ayana, on scaling up. When I was at the Emory Healthcare Innovation Hub, we were working on, various pilots to understand how some technologies in small scale could be used for at least a select group of patients to start. And and you see that perspective with the providers as well. And so that's excellent perspective. And then the other comment I was going to note was that, again, this collaboration concept and engaging the providers and the users in the space is really, really key. And so going off of that, we're going into our next question break. These are going fast, guys. Everyone just pay attention. And as you can see, we're really engaging the responses here. So the next question theme you guys are seeing popping up is digital health and the impact on healthcare delivery. So take some time to answer those questions now. And as you guys submit those things, I'll note that intentionally it was single choice so that you guys can really put those high in your priority. As we know, a lot of you, like, especially for the second question, check all of them, right? But that's kind of the approach we're taking this time. So as we wait for those question responses, wanted to bring up back to our panelists some additional questions. And so this next question is, as more and more digital health and wellness related apps and devices arise, how do we in the healthcare ecosystem ensure that we simplify and unify health and care rather than further fragment the consumer or patient experience? So with Scott.
Yeah, thanks, Eddie. I mean, I know I'm speaking to the choir when I say sometimes it's just hard to get internally everybody to agree on one application or one solution. So with that being said, we often found ourselves with multiple solutions. It kind of gets back to capability and rationalizing out that experience. But I think the biggest thing is for us in particular, we're an Epic shop. We always look at what's on platform. So if it's in platform and that pipeline for platform with Epic, we're going to choose that. But then we also have the ability to go off platform where it makes sense and, partner with outside companies to develop solutions or architect an experience that we know going into it may be a short-term, short-lived solution for us and our patients and caregivers. So we may choose to use that for a couple of years and then migrate back onto platform. But I think, keeping the end in mind, because what you don't want to do, in my opinion, is give the either it's the patient or the caregiver a fragmented experience where they're going to all these different systems and apps and they're trying to interact with you in a meaningful way. If you do have that situation, how do you wrap a digital door around that experience so that they're coming through one place to interact with your assets in the organization? So
That's great. Yeah, I think, like you said, that digital front door concept is a term been increasing in usage and popularity for some of these health systems. Going off that and kind of engaging with the consumer, I know this is a question for Lori with Catalyst. With some of the approaches you're taking with working with organizations, local and otherwise, like Home Depot or other groups that are in that engaged, or Chick-fil-A even, right? They really focus as brands and as companies on the consumer or customer experience, right? In this case, patients are healthcare systems customers. And so again, I'll ask that question back to you on, as more and more of these digital health or healthcare and wellness related apps or devices arise, for Catalyst, how are you approaching the concept of simplifying and unifying these health devices and opportunities to help the patients and not fragment it?
Yeah, it's a great question, and it's an ongoing challenge as we continue to see startups that will use some sort of device, either one that they've invented themselves or existing devices. They create a patient app, and then they have a clinician dashboard. And how do we migrate all that information into the EHR to make it easier for clinicians to access, to be able to monitor in real time, to give that 24/7 access? I don't know that we are working on that. I don't know that we have it completely solved because it looks very different for each of the startups. And to kind of come back, sorry to revisit the piloting issue, that is a key point of, or key action of Catalyst. That is exactly where I sit. As we source startups and do the diligence, can we bring them within Wellstar and do that kind of diligence, run it past our clinicians and pilot it in a small way to figure out, kind of pressure test the idea. Does this really work? Does the science hold up? Is the user interface friendly enough that you're going to interact with it, that all people can interact with it in a way that's friction free? I think this is just, it's an ongoing conversation that we're having that we don't totally have solved on our end, at least from the Catalyst perspective.
Yeah, and I think we all in healthcare know about love our data. And I know, Lori, you coming from epidemiology background, like you said, that data is super critical in both not only understanding the situation, but helping drive decision making. Obviously, not the only factor, but certainly in that piece. I want to go back to some of the questions. If you guys are navigating on your Zoom screen, the poll results, I'm able to see that. It might just be me as a moderator, but I just want to revisit some of these questions on how is the impact of implementation of digital health technologies affected the patient experience in your organization. And there's this concept, over 50% said somewhat improved, and with another group saying significantly improved, which is really awesome. I'm wondering, Scott, if you talked about some of the councils you put together and things like that. What's been your experience with implementing digital health technologies, and has it improved different outcomes in your org?
Yeah, I mean, satisfaction, I think, is key with anything, especially patient satisfaction. So it's something we're constantly monitoring. I would love to say that everything we do technologically is improving patient care, but I know it's a lot of other people in the organization that are moving the needle in that front. But, to what Lori was saying, we've got an innovation center, and we recently did it was basically a Shark Tank event where we had, I think, 20 different pitches where people came to us and said, hey, sharks, and it was a panel of 4 of us that actually voted and decided to fund it. But what Lori was saying about, you've got to start small on some of these things. You got to do a proof of concept. I always say, if the POC is good, then we'll scale it. But sometimes those solutions don't make sense to scale, or we can't scale.
Right.
But the fact that we're just listening to what we want to do inside and outside our organization, of how we could come up with different ways to do different things. But I mean, at the end of the day, those experience councils for us are going to be pivotal moving forward, that they're giving us a feedback loop of, this is working, this isn't working. And we may have to refine and fine tune some of that experience to make sure that it's providing value to them.
That's excellent. And again, going off of that second question, again, there's a note that would love to select more, but this is kind of the biggest topic that biggest item that most people would want to see. And it's this concept of, like you said, Scott, you're improving patient outcomes. But there's also the increased efficiency and reduced costs concept. With going back again to Lori and Catalyst, with Wellstar's approach with having this Catalyst program, I'm curious to see what any feedback at all that you guys have received from the system or the providers as you guys have engaged in, or even some of the perspectives of those people that you're engaging on the technology side with.
Yeah, I will say that with some of these startups, as we, are kind of doing this proof of concept and try to kind of kick the tires on, is this really going to fly? Can the startup really deliver what it's saying it can deliver? And we are so fortunate that we have stakeholders, huge groups of stakeholders or clinicians with whom we engage to kind of get their feedback in real time about how this is working. They are reluctant to put their necks on the line for solutions that don't necessarily have a peer-reviewed publication track, right? Maybe the most they have a white paper, or maybe it's just more theoretical in concept. And are we gonna, how invested are we gonna get in a concept that sounds really good on paper, like, being able to measure hormones through sweat that maybe has been proven in animals, but we don't know 100% in humans. And so, it's always kind of testing with our clinicians, how comfortable are we with this and moving this concept forward and even moving it to the pilot. And that's not to say that every startup that we fund even comes into Wellstar as a pilot. Sometimes it just doesn't make sense. We can't figure out how to do it, but it might make sense for another industry like Delta. I hope that answers the question.
No, yeah, that does. I think you touched upon within healthcare orgs the diversity of the perspectives. Obviously clinical focus and the way folks were trained, and how they approach innovation or implementing digital health technologies. It's not, like Scott said even earlier, it's not doing it for doing its sake, but really helping engage the patients in a way that's ultimately beneficial for their care, and also helping the providers. Swinging back to some of the partnership piece, Ayana, you come from this perspective where you're working with a lot of different orgs, and Siemens does, and the different divisions, like you said earlier. And it looks like your comment on piloting really helped drive some excitement. I'm curious to see if there's any on the kind of different, I guess my question is, on the healthcare organizations that you've worked with across different spectrums, what creative approaches or things that you've experienced with them?
Well, I was kind of listing some of those. The creative approaches is really what we're talking. We call them co-creation sessions. In Siemens is where you sit down and you actually pull some, not just the facility people, but sometimes you pull, people from the nursing staff and from the OR, environments and you sit down and ask them about their job. You ask them about the pains and what works and what doesn't. And that's the type of creative experience we get some of our inspiration from. We may have a technology in mind that we're trying to develop. So we'll ask questions that kind of relate to what they do in that job and ask where are the, disadvantages and advantages. And from that discussion, we're able to translate into the technology. We really don't focus on the technology when we're in those discussions. We listen to their experience. And then after that, we may be able on the fly to say, hey, would something like this be advantageous to you? And we describe it still from an experience perspective. And then after that, we may go into talking about the technology. And there's always, you still have to bring the technology that you're talking about into the discussion, even with those teams, because there's certain individuals, we call them personas, in a hospital healthcare space where you may not want to give them all of that. You want the ability, you want the capability, but you don't want that, we call it a user profile. You don't want that user profile to have access to this much of that capability. And so that's from Healthineers from a medical technology side, even on into the infrastructure. Conceptually, we're really talking about what is the use case or desired outcome we want to have? Who do we want to have that experience? How much of that experience should they have access and control over? And then after you do that, you build your technology around that approach. But that's the typical co-creation type process that we follow. And that's where a lot of the creativity falls. In my previous years, I was a consultant, and I did that for multiple industries, but it's really, really fun to do it in the healthcare space.
Yeah, that's fantastic. I think, like you said, seeing the different orgs approach it in a way that they're engaging with vendors creatively as co-creation, but also noting that everyone approaches technology a little bit differently, and the way they engage might need to be tailored for each person is important. I want to go back a little bit to some of these, even the chat right now. There's been discussion in the chat about this data coming in, right? People are responding that in the poll that they've really seen some impact, and there's some questions on and comments on how do you actually measure that impact? How do you measure what measures or KPIs, key performance indicators, are systems or groups looking at to see the success of the implementation? Scott, would you be able to speak to how your organization looks at the data and sees measure success?
Yeah, I mean, I think looking at the data, so whenever we're not the best at it, I'll just admit that we're standing up more sophisticated PMO functions, but I think for anything that we do, we need to be very prescriptive about what are the outcomes we're trying to achieve. Again, not doing technology for technology's sake, but what are we trying to achieve here, and bury that into the overall management of the project, that the team's constantly looking at those metrics. Are we meeting those metrics? Are we not? So those KPIs and those performance indicators are just part of the story. They shouldn't be. I think too often I see organizations, as a consultant, I saw organizations do stuff and they were like, well, we didn't get what we wanted, so Scott, come in here and fix that. Well, you should have thought about that in the very beginning. So if it's part of the storyline, in my opinion, that you're constantly looking at that and measuring your success and your ability to execute against that, you're going to get closer to hitting the bullseye of what you're trying to achieve.
Eddie, do you mind if I jump in there? He hit the nail on the head when he said that, because honestly, if we think about the pilot programs and what Lori's talking about, how they bring those startups in, at working in an agile way where you're checking back frequently, that's a good way to avoid that. Sometimes you put KPIs in place, you put an outcome and document it, and then you go implement, and then you see, to his point, it's really far from where we wanted this technology to be and what we wanted it to provide. But if you define some milestones as you go along the way in what it should do and deliver, you have a higher chance of achieving the desired outcome. And this is like even just a pilot approach, like what Lori's talking about with her startups, or if you do a partnership with a technology provider, structure your engagement with them that you're defining milestones along the way that let you know you're going in the right direction, you're getting the outputs you want. So that's an approach, another consultant approach too. Scott knows about that.
Yeah.
If I can jump in too, as a public health person who worked in evaluation, you start with the evaluation plan first, start as you mean to go. And to Ayana's point, you make those course corrections as you're moving along. It's kind of this iterative approach. You don't have this full-blown solution. And that's really what Catalyst is offering. You think you've got this solution here, We're slowly piloting this. We're learning, we're refining, we're growing. Maybe this works here, this doesn't work there, but this iterative approach to keep refining the product so we have a better product that really meets somebody's needs and again, reduces friction. And to the point in the chat about engaging clinicians in the design from in the get-go, that's exactly where we want to be. That's exactly right. Because if it doesn't work for them, it's not going to work for all. Right? It's not going to work at all. We have an alarm fatigue platform right now. We are piloting in the ICU. Frankly, if the nurses don't know how to use it, then it's a failure. We have to figure out how to meet nurses where they are, create a user interface that makes sense for them so they can engage and actually use it.
Yeah, that's fantastic. Really great insights. And I think you're seeing, again, even in the comments, a mix of different perspectives from a diverse group of stakeholders and attendees, if you will, seeing some of those pieces. I'll note a comment that, there are some startups, again, as we go into the space, digital health space, you got people coming from all kinds of backgrounds, which I think is fantastic. I engage with, in my role at the chamber, all kinds of different founders and things like that. But there's a great comment on, if you're innovating for the clinical space, it is important to have clinical stakeholders in this in this development. So, Ayana, you touched upon it, Scott touched upon it, and Lori touched upon it. So that engagement piece is key with both the users of the technology, whether that's the providers themselves on the back end or the front end, but as well as some input from the different patient populations that might engage. So that leads us into I think actually our final kind of question time for the audience. So this question will be popping up soon. And again, it's a little bit of a follow-up on how we approach this poll, but the question theme is future trends and innovations. And so just please take some time to answer. It should be just one question this time. Again, I think a lot of people can put multiple on these, but pick the one that you feel most strongly about. And as we kind of await some of the poll responses from the group, goes into our final question time before our Q&A. And so this question is, what do you think will be some of the next big innovations in the digital health space? We'll start with Lori.
Oh my gosh, I love this question. Where to even start with it? It's some of the new approaches to old problems like cancer screening. I have seen 2 startups lately that are using wavelengths of light display that are projected through urine in order to detect cancer. One is breast cancer and one is bladder cancer. I mean, it's absolutely incredible. And it develops a light signature and a pattern that you can see based on urine. I think we're seeing more and more innovation around devices. Again, I mentioned the wearable that's trying to be able to monitor in real time hormones through our sweat. These devices that basically can stay on your body 24/7 for constant monitoring. I mean, I feel like that world is just blowing up right now. And it's one of the reasons I love this job. You get to see all these creative minds coming up with these innovative solutions to problems that have been around for a long time.
Yeah, and as we wait for the poll results, it kind of touches upon, Lori, to your answer, this Internet of Things, right? Internet of Things, wearables, telemedicine, virtual care, if you will, some intersections there. Ayana, what do you think will be some of the next big innovations?
Okay, well, to be consistent, I'll answer from 2 perspectives. From our sister company, Siemens Healthineers, I think I'm most fascinated. I think it's really going to take off is the digital patient twins of the human body. That is really going to advance patient care for a lot of providers. Doctors, they're increasingly able to better predict how a person ages, when the illness will appear, what course of treatment they should take, and which treatment may be most effective. And, I think that's at the core of what we mean in Siemens when we say combining the real and digital worlds. It's on the healthcare side, it's in our factory automation, it's in our infrastructure with buildings. We're literally trying to combine the real and digital, but even in the healthcare space, right? But I will point out that for this to be as effective and successful as it can be, the digital networks within a healthcare organization will have to be optimized. Data has to be accessible from system to system. You can't have well, I'm going to say can't have, but you want to have less, if no, proprietary systems where you can access that data. Do you need all of it at once? No, but you do need to know that you have access to it. So I do think that's going to be a key factor there. And then from the infrastructure side, some of the biggest innovations we are seeing when we work with healthcare organizations, it comes from increased integration. I kind of mentioned that at the very beginning of why this topic was relevant for me on the facility side. Increased integration of the infrastructure, or what we call operational technologies, medical technology, and your IT systems, the EMRs, the work management systems, CMMS systems, the financial systems. As I mentioned with digital twins, data transparency here is going to be paramount, and having access to that data in all the various systems across the organization is really going to be key. And deciding on the right use cases for this is really going to be the biggest thing. And that's also from a hospital operations perspective as well as facility. But that's where digitalization, digital health, digitalization all the way across the board is really going to take off, is the more we can pull some of these systems together.
Yeah, that's really cool. I'll do a fun little interlude as we talk about this concept of digital twins and measuring some of the data as we, replicating the concept. So I just was taking some time to take off this device I got. It's a ring. It's an Aura ring, which is interesting. You guys might have heard of it. I'm still getting used to putting on the ring and things like that, but it measures all these different biometrics, and obviously not a perfect tool, but for someone like me who's trying to evaluate my sleep as an aspect of my health, it's super interesting. And to that point now, what's interesting is that I got it actually through FSA, and so like that's kind of that concept that you're seeing. And so additional to this question, Scott, you talked about this really cool concept of a Shark Tank, right? RFP. You're hearing from the front lines and getting into the Gemba, and not quite into the Gemba, but in the sense of like you're hearing from people who are doing this work. Additional to that, like, what do you personally or as an organization think are some of the next big innovations in this digital health space?
Yeah, thanks, Eddie. So, I mean, obviously, Emory is a great research institution. So I would be doing our researchers and our academics a disservice on this call if I didn't mention that. But, personalized medicine, genomics, we're doing great things in that space. But I think from my vantage point, the things that are keeping me excited about what we're doing in healthcare is AI and machine learning. I feel like from an imaging standpoint, what we're getting ready to launch with pathology and radiology analytics and AI on top of those images is really going to transform the way we can treat patients. But something that, feels good right now for us is we've launched ambient listening in a big way. We've got about 700 doctors to scale right now. We're going to go bigger with it. But, I've had physicians interact with our team that I mean, they're no joke. They're almost in tears, that they're like, I don't know who came up with the concept to roll this out. So with ambient listening, basically we're empowering physicians to say, hey, Eddie, we're going to have a session here. Do you mind if I use this tool? And it's capturing a 25-minute conversation, and it's pushing that through the cloud through generative AI, and it's pushing out a SOAP note. And so basically our physicians are almost in tears. They're like, you've changed pajama time for me. I have a life now. So that, at 9 or 10 o'clock at night, when I'm trying to catch up with documentation, they're telling me that we're saving, 3 hours a day of their life. I mean, to me, that's where technology is really making it happen. And it's exciting to hear where Epic potentially is going with ambient listening in their modules, and, get to a point where it's like, hey, Epic, and it's interacting with you. So the AI machine learning aspect of where the industry is going, it's promising, but I got to say, it's somewhat scary. I mean, you see all these people talk about what AI could do, not just to healthcare, but the human race. And you think, okay, we want this cool thing, but are we going to control it, measure it, and monitor it in a way that it doesn't disrupt us as a humankind in essence? So.
Yeah, that's so important, Scott, and it's really cool to see, like you said, we oftentimes think about in digital health innovation and implementation the impact of the patients, but more in this example you shared, I mean, such an impact to our providers who are working so hard, and have seen innovation in the research space, like you said, but also now in how they do their day-to-day, right? They see innovation in all these other. And I know Lori has experience with this with Catalyst, but like innovation in how you order from a chicken sandwich from Chick-fil-A, right? Innovation, how you book a flight. And now you're seeing some of that innovation on the patient or in this case, provider experience and some of the technologies. So that's interesting. I want to bring up again now the poll results. Thank you everyone for answering. So this question again was under the topic of future trends and innovations, and the question asked the group, what area of digital health do you think we'll see the most innovation in the next 5 years? Again, 5 years goes pretty quick. And so with that, the top result getting answer was AI and machine learning with 66%. 2/3 of the group said AI and machine learning. Then the rest are a little bit of a fraction of the answer, but you said telehealth and virtual care, which of course we saw a lot of in COVID and coming out of that. Personalized medicine and genomics was next with 12%, and a very small minority voted for the Internet of Medical Things and blockchain technology. So I'm wondering, given some of those results, if any of our panelists would be able to speak to that. Maybe we can start with Ayana on this piece of AI and machine learning, perhaps.
Well, definitely, I will speak from the smart infrastructure side. I know our sister company is, but I'm not as in depth in their operations. But we're actually using AI to create a healthcare app for our facility managers. But it's now not only looking at facility managers, but we're talking about what about nurses and what about the OR schedulers or charge nurses at the OR level. We want to make sure that, some of the conveniences that they have to call on facility for, some of the things that they have to kind of oversee and control for themselves and the patient's environment, maybe it makes sense to give a little bit of that to them. And that's where I was alluding earlier. There's some capabilities you want to have for them, but then there are some that you don't. So we're using AI in our technology with creating new apps that takes existing data, existing systems we have, and it pulls the data into a very structured format and allows us to personalize it for a persona, a user profile, a nurse, OR person, lab technician, facility person. And so with that being the case, once you get the data right, AI allows you to really kind of take it to the next level. I think Lori talked about alarms and alerts and alarm fatigue. Well, then you can start accessing databases. So not just alert someone, but tell them exactly how to address that alarm. And you have, because of the integration of the systems, the AI is really intelligent about telling you where to go next and what to do to resolve that. So that's some of the things that we're working on, even from the facility infrastructure side, but it will have an impact on those people that are in the healthcare space providing healthcare.
Yeah, Ayana, that's exactly right. Sorry if I cut somebody off, but it's taking existing data sources, pushing them through an AI algorithm, being able to refine it and provide personalized care. In the case of alarms in the ICU, it's upwards of 99% of those alarms that are unactionable. A nurse has got to get up and go look at the situation and turn it off. What if we can calibrate those alarms so they're truly alarming when there's a reason for them to alarm and not just set to some factory preset, right? It's going to transform the whole environment of the ICU and hopefully improve patient safety because you're not desensitized to alarms just going off constantly.
Exactly. And we're kind of feeding off each other here. You think about critical spaces, so lab space, burn units, all those really unique environments where the environment plays a major role. You don't want to have things like alarm fatigue, causing a lack of care or, lackluster quality care. So that's all of these things have an application. AI is going to kind of take it to the next level. And we're working with organizations to find out exactly how they want to see it implemented.
Yeah, that's fantastic. So I'm curious, Lori, you had additional insight on that last question, but looking at some of these trends, you guys are engaging with all kinds of startups and evaluating the market. Is some of the responses in the polls, again, with kind of this AI focus being the largest and telehealth next, personalized genomics third, and Internet of Things and blockchain being kind of last, if you will. What are you seeing? Is that reflective of what you're seeing in the startup space and other companies you're engaging with?
AI is everywhere and in every form, right? I mean, you can't throw a stick without hitting it, without some startup using it in some way. It may be a cancer assessment where, you're taking it online, but there's AI working in the background to calculate a score, determine your risk. Do you need to be screened in a different way? It's seen more frequently. It's from the alarm fatigue, it's to imaging, being able to read thousands of scans and be able to detect cancer at even earlier stages. I mean, all the manifestations of it are there. It's just, then it's kind of the data quality issue that, can we get get access to some of this data that lives very deeply within devices to be able to turn it around and give it to a startup to develop the AI algorithm. I mean, that's another challenge, but yeah, it's absolutely everywhere.
Wow, fantastic. I'm curious to hear on a healthcare technology side, Scott, your perspective on some of these responses, or are you seeing some of that reflected in your organization?
Yeah, to what Lori was just saying, I mean, that Shark Tank concept with the Innovation Center, the 10 finalists, I mean, just off the top of my head, I would say 8 of the 10 probably had an AI component to it. So to what the panelists are saying, I mean, it's everywhere. It's, it's almost a buzzword that a lot of people are using, like, oh, we use AI. And I'm like, well, show me. And I'm like, well, that's not really AI. You're just using that to kind of tag something to get on a wave. But yeah, I think artificial intelligence has a lot of promise. If we use it in a controlled and meaningful and measured way, yeah, it absolutely has value. And it's exciting.
Yeah, it is exciting. You're seeing it, obviously, yeah, not only in healthcare, of course, but in all industries all around us. But that important note you made, Scott, about kind of the guardrails and the safety. Obviously, it's very sensitive data, but also very actionable and really insightful data that we can use to impact a lot of things. Hey, our tech person, would we be able to mute everyone again?
Rodney Lowrod Jones Lawson.
We just mute. Yeah. Okay. I think we're all back on track a little bit. Yeah, it's I was just gonna note in the chat too, before we move on very soon to our next section of Q&A, is that there is a chat link from Sandra McGarry for everyone to please take a minute not only to mute, which everyone did, but take a moment to complete the ACHE evaluation for how we're doing as a panel today. But no, really great insights by everyone. So I'll take this time to now I think you've been very active on the chat, very active in the polls. Again, we want to make this an interactive time. We're going to move into an audience Q&A time. And so again, this is a Q&A from the participants. You can now take this time to either unmute yourself and ask questions live to our panelists directly, or you can ask in the chat. And I'll help moderate that time as well. So I'll open this up now to audience Q&A.
Eddie, I have a question.
Go ahead.
So have y'all seen anything, because I have not, where anyone is addressing how we as healthcare leaders are going to approach this disruption? So whether to keep this from being the next shiny object, right? Because it feels to me like, as Lori said, it's everywhere, right? We are inundated with it, almost to the point I'm sick of hearing about it. But what I worry about is, as I mentioned in the chat, you've got this bright, shiny object that has some great potential if it's rolled out correctly. How, as healthcare leaders, are we going to take these opportunities and apply them effectively and not have it be something that, I guess, get the best use of it, right? So is there anybody out there from a leadership perspective that is taking this approach? How are we going to approach this correctly to where it's sustainable?
Yeah, and just once again, thanks Dee Dee Fridge for that question. For anyone else asking additional questions, just make sure to mention your name. You can say where you're from, but I'll open it up to our panelists to see if they have any responses or thoughts on that.
Yeah, Eddie, if I may respond to Dee Dee. I mean, Dee Dee, you're spot on. So I mean, I feel like AI is the new buzzword, but going back to what we talked about earlier, if we as leaders are very prescriptive about what we want to deliver, we're very clear on what those deliverables look like, with the value proposition that we're trying to do, then in essence, we've pushed AI into the back of house as the solution to that outcome. And it's not the forefront, because I think we could quickly fall victim of like, oh, it's cool and we need to do it, but we're not really thinking through it. So I would suggest that we just stay clear on what we want to deliver and what the outcomes we're going to achieve, and let this kind of technology drive and push it through, but not be the primary focus. I don't know if the other panelists have ideas.
I agree. I agree 100%. And that's why some of the sessions that I was describing early around co-creation, you really shouldn't talk about technology first. You should talk about what is it that you need to accomplish. You have your organization strategic goals, you have departmental goals and KPIs that you need to achieve. You talk at that level. You talk about the roles that need to be performed and where the challenges are. What would be a better way of operating? And when you have that discussion and you kind of create a storyline, a picture of how this would flow or operate, then you back into the technology from there. I love the way Scott just said it becomes a part. Would you say back office, Scott, or the back of the office or something like that?
Back of house, back of office.
Back of house, yeah. It should be, because we anything we do from a digital perspective, we need to answer what is it that we want to do and why. And why is probably the biggest question. And then, how do we measure success on that? And then we also iterated earlier about having metrics. I do think accountability to make sure that we're following up on what we said we wanted to do, that's going to be big. It's hard to kind of manage all the things we have to do, but if we say we want to invest in a technology or a solution, what are the key things we want to see coming out of it? And we keep coming back to that and making sure we're hold the proper parties accountable for getting us to that state. And that's your partners, that's your internal teams who are supposed to provide data and input and feedback. We need all teams, everyone, all hands on deck, doing what they said they wanted to do. Hopefully that addresses it some, Dee Dee.
Eddie, if I may add one final thought on this topic. I think a lot of times in a lot of organizations, IT is used as a commodity or utility. So one of the first things we did last year when Dr. Erskine and I joined was at Emory, the division is called Emory Digital. We do not say IT anymore. So we are digital enablers of the operation, and we're digital partners to find solutions that are going to enable the business to transform. So maybe in just the nomenclature of what we call your technology group within your organization could change that mindset of like, okay, we're going digital in a meaningful way, but these are our digital partners and digital enablers, and not just our IT department.
Yeah, that's really cool. It's a really intentional way, Scott, to demonstrate how I think when I was been in, as many people here have been different healthcare orgs, it's this concept of IT, like it's not the afterthought, but it's just like, okay, they're there, turn on the lights, keep the lights on, this is broken, fix it. But you're really demonstrating how Emory has this really, and not just Emory, other groups in Georgia and a nation and worldwide are really engaging this piece, because now, like it's like a utility. It's essential for operations, and as we talk here on digital health, it's only going to continue to be more, and it's keeping that in mind of how do you use that for good, and with the knowing that there is pitfalls. So this is fantastic. I'm seeing now a lot of engagement. I do want to acknowledge that some people have raised their hands, some people in the chat, so I'm going to go as best I can.
Eddie, do you mind if I jump
Please,
in?
Ayana, go ahead.
To close out Dee Dee's question, she put a statement in the chat that this would be a great webinar white paper for someone to produce. I say let's put it through one of the AI tools and let them write it for us. And then you guys submit it that way. Since we're talking about AI, you might as well use it for that purpose, because to
I love it.
transcribe this or might as
That
well.
is very interesting. I'll tell you what, I sit on a different board, and there was a panel where they had as their fourth panelist ChatGPT or some other GPT program. So that's really cool. So I'll acknowledge Gina Tipton has a hand raised. So Gina, do you have a question for the group?
I do. I was really fascinated with what Scott shared about the ambient listening. It's something that fascinates me. And as a person in rehabilitation, I'm always looking at the therapist, who have to have hands on the patient and can't do bedside documentation and point of care documentation. Scott, what do you see as the future for ambient listening to take the burden off of therapists, nurses, et cetera, not just providers?
Yeah, Gina, good question. So, I mean, right now in our organization, ambient listening is primarily focused with physicians in the outpatient setting to automate that process. But we've got so many different use cases for ambient listening. So, to your point, it's not just physicians. We're looking at nurses, therapists, techs, anybody that generates a narrative note on the encounter. They're on our radar screen to the point where we're actually exploring black box technology potentially in the ORs, so that ambient listening AI module is in the OR suite and it's capturing everything so that the operative note could be collected. So yeah, I don't want to, when I said ambient listening, if I gave you all the impression we at Emory are just going to focus on the physicians, they are very important. But my sister's a critical care nurse. I mean, I've got to make sure that our nurses and our caregivers and therapists are part of that journey as well. So
that's fantastic. And again, I think we'll be mindful that we have about 11 minutes left in our Q&A time. I'm going to be a little bit topical, and you talked about that critical care nurse connection, or including other perspectives in this. There was a question in the chat from Danielle Dickinson that said there is also going to be a nursing shortage in the very near future. How can we assist with this challenge digitally? Anyone want to speak to that?
I could, but I'm curious to hear what Scott has to say.
Sure. I mean, we're doing everything we can from an organizational standpoint to combat just the nursing shortage and the contract labor cost, et cetera. But one of the ways we're using technology in a more innovative way, I mean, obviously, Emory's got the School of Nursing, and we've got a simulation lab over in Decatur that the nurses are going through that's using AI and simulation in a controlled setting. So we're actually streamlining the way we can actually deliver education. So part of what I'm doing is we're going to stand up an innovation center on the healthcare side, but we're going to pull those simulation labs out of just the School of Nursing and actually do it so that if I'm a nurse, typically I would have to have someone shadow me or proctor me on some of this training and education. And basically we are going to use simulation labs. And that's why I want my innovation center like right adjacent to it. So the workforce is coming in for their mandatory trainings and simulations, but they're seeing showcases of what does the patient room experience of the future look like? What does that at-home telehealth look like? Who are the partners that Emory has at play so that they get excited about working here? But I think anything that we can do as leaders to lift the burden off the nursing staff. I think there's tons of opportunity to use technology, again, in a meaningful way, not just doing tech for tech, but you're doing it to do something that's going to change their world. And it gets back to that ambient listening solution. I mean, when I'm walking the halls and rounding and I interact with a physician, like if you had a hand or a voice in that ambient thing, you've changed my life. That makes me feel like what we're doing is making people more enabled. And we're looking at different device endpoints. We're doing a lot of stuff with Apple. So, if you've got a preference for an Apple endpoint, we're letting you get that as a preference, because if you're able to interact with technology assets in a better way, I think you're going to be a better caregiver. So.
That's great. Ayana, I think you wanted to hear from Scott, but didn't know if you had other thoughts on your own.
Very, very small input, but he hit the nail on the head when he said, reducing the burden that's on them. There's a factor of nurses we won't be able to avoid losing just because, right? People are changing careers, and so you kind of have to factor that in. But with those that remain and those that aspire to be the technology, listening to what their challenges are and designing that technology around them with that in mind, that's going to be big. But then also, digging deeper. We talked about partnerships early on, partnering with some of these nursing schools, getting these nurses involved in some of the tech exploration will kind of, because everyone, if you think about the generations that are coming into nursing now, they all have a technical skill set or, adaptability that some of us didn't have growing up, right? So the more we include tech that they're used to using in their normal and personal lives, they won't look at nursing as like a traditional profession. They'll look at it as something that, oh, I think I can do this too. So, introducing them, don't be afraid to put that digital stuff in front of the newer generation. They're probably going to eat it up and innovate on top of it like you've never seen, but reaching deeper into the educational system, upskilling them as much as possible. It's not just nurses, it's going to be in the tech field for the medical equipment, the technology, the technicians that have to operate that. The same thing there. Bring them into the design phases early on and let them be a part of the development process. That will help.
Yeah, just on this piece, I know, Laura, you unmuted yourself. Oh, actually, yeah, go ahead.
I was just going to offer, I mean, with Wellstar Medical College of Georgia, I know something that's being explored are the remote patient monitoring for pregnant folks through devices. If you are a lower risk category, can we reduce the number of inpatient visits in a small increment, going from 12 maybe down to 8? Monitor them where they might have difficulty getting to an office anyway, but be able to free up the clinician's workload for those who are in greater need within the office, or just to free up more time, period, and not contribute to more burnout. I mean, it's just one very small example of one application of one of our startups.
Yeah, and that was what I was going to ask you about too, this concept of, yes, how do we supplement or address that, but how do you also kind of tackle this burnout problem, right? And not, yeah, this opportunities to engage the staff. I want to scroll back on one of the chat questions earlier. This is typed in from Marlene Sidon. And I'll just do a quick reminder before I share Marlene's question for everyone. Please click that link that Sandra sent in the chat to fill out the evaluation form for this session and give us good marks.
And Eddie, you also have a question too.
Yep, I see it. I see it. Yep. So Marlene asks, has anyone defined key priorities for digital health for the patient, doctor, and staff perspectives? I'm curious, we talked a lot about the staff just now and doctors. What's been the approach that some people have seen for the patients?
Stand up a patient experience council would be Scott's answer. So, one of the experience councils is focused on patient experience. So it's got not only operational leaders, but, a sampling of patients that have had our services to kind of weigh into what they want from us as a provider.
Excellent. Again, opportunities to connect with the end user, if you will. I'm going to focus on this question or the hand raised from Craig McGowan.
Yes, thanks, Eddie. I appreciate that. And thanks, Ayana, for noticing that my hand was up. Just want to say this has been a fantastic panel of experts, and thank you all for joining. I'm going to switch gears for a second, if I may. My question surrounds really collaboration within the community. And my question is collaboration within the community is really vital when determining how to address digital health in the healthcare delivery system. So for success of any healthcare intervention, the cooperation and engagement of all community stakeholders, in my opinion, is essential. So my question for the panel is, what is your vision for digital health and the healthcare delivery system to engage patients and community stakeholders to address healthcare intervention?
I will say within Catalyst, we have an entire team devoted to listening, right? And listening deeply and gathering up, concerns from our patient population, from our clinician population. But we also really work closely with our community teams. Every time we've got one of these startups we think could touch them, we bring it to them. And we have them pressure test that idea. Does this make sense? Is this something that you could use? I mean, they are so integral to us vetting these ideas, whether or not we're going to bring them in and pilot them and potentially invest in them. I think you raise an excellent point.
Yeah, Craig, if I may, I think this is where some of the rubber hits the road. I mean, from my vantage point, what we've done within Emory Digital is put marketing comms resources as part of our portfolio. So we've got our own marketing comms resources. So how do those plug into the external facing marketing comms teams that know how to engage people in the community, that are doing health screenings, that are doing stuff, touch points with the community, so that those experiences are married from a digital standpoint and an exposure standpoint. But I don't know that anybody's doing it really well. We're still kind of in that infancy stage because we just stood those teams up and those resources in recent months. But the intent and the goal is to make sure that what we're doing digitally is closely aligned with what we're doing externally facing with those patients or people in the community that could be a patient of ours. So
that's a very good question. I agree. I want to kind of spin it a little differently because we talked about partnerships earlier on, and Healthineers, they focus a lot, what they call these value partnerships. If you look them up online, you'll see more what they're about. But basically, there's different modules that they will structure in a value partnership. It's like a 10-year engagement where health equity may be an aspect, workforce development may be another aspect. And I would say the workforce development is one where we probably share between our two sister companies a lot of work to be done. And so in some territories, there's a partnership that just started up in St. Louis, where one of their pillars of the value partnership is focusing on workforce development. And that's going out and looking in the community, the surrounding community, where they have a labor shortage within those healthcare organizations, and actually partnering with local schools, tech schools, to help develop the skill sets and trades that are needed to support this digital technology. So they're doing it from a medical technology perspective across the country. I have a lot of branch offices that will actually partner with local tech schools to educate, to get them into the tech programs. We put our products in our portfolio into those tech programs, obviously free of charge. We help with the curriculum, help educate, and really kind of open people's minds about the careers in healthcare that they could be tied to. It's not just on the clinical side. You can be tied in the facility support, on the technician side as well. So we're kind of operating in that, and there is a lot of community engagement. And we work with like I think it's the Urban League up in St. Louis, where we're working with them on different workforce development, career development, upskilling solutions. Like I said, some of our teams locally, we're going out and we are working. Sometimes when we have projects that a hospital or something we have to build, we'll start 2 years in advance and invest in a local program, and then hire those same technicians and skilled trade people into work onto the hospital, construction project itself.
Mhm.
So it's
That's fantastic.
multifaceted,
Yeah, that's fantastic. Well, time flew, guys. Again, a lot of activity in the chats, even some partnerships. Again, fill out the evaluation form, and it's as a moderator, it's been an honor to share the stage with Lori, Ayana, and Scott. Some great professionals from different backgrounds in the field. And I'll turn it back over as we close out to John Paul.
Very good. Thank you. Thank you, Eddie. And Sandra, do I need to turn this to you right after I speak, or do you want to go first? And
No, I need to go last. That's thank you though.
You'll go last. Okay. So thank you again to Eddie Lai and all of our panelists. Please give them a virtual round of applause. What a great afternoon to be able to spend with all of you guys virtually. Thanks also to Pedro Ordano, Shawana Jackson, and our programs committee today for organizing to get today's meeting. Thank you again to our sponsors. We appreciate all of your leadership for the healthcare industry in Georgia. Special thanks to ACHE for again hosting today's program so that we can offer you these virtual interactive credits. And also, as a reminder, please be sure to complete ACHE's meeting evaluation. Your survey feedback is very important to us because it helps us strive and continuously improve our programs and content of our education programs. And now, at this time, I will turn it back over to Sandra McGarry of ACHE for some closing announcements. Thank you.
Great. Thank you guys so much. On behalf of ACHE, I just want to thank our chapter leaders that planned today's session, our moderator, the panelists, and all of you for your participation. Again, you've done a great job of reminding folks, please complete the evaluation, which is open for 1 week. The direct link is in the chat box, and you can also access that by visiting your My ACHE page and selecting My Online Learning from the helpful links section on the right-hand side of the screen. From there, you will click on Access My Courses and will be directed to our learning management system where you can complete the evaluation. In that same location, you will be able to access the recording of this session within approximately 2 business days. For everyone who attended today's event in its entirety, you will see your 1.5 hours of virtual interactive education credit posted to your My ACHE account within 2 weeks of this session. And again, that will be in your My Education credit section. That does conclude our session, which is copyrighted in 2024 by the American College of Healthcare Executives. All rights reserved. Thank you, everyone.
Thank you. Thank you, Sandra. Thank you, Eddie. Thanks, everyone. Thanks, panelists.
Thanks, everybody.
Program.
Thank you.
Everyone, have a
everyone.
great week.